So this is an outline of some of the things we're going to discuss. We're going to basically review what a hormone is. We're going to talk about the menstrual cycle. We're going to discuss some of the hormones that are relevant to what we're going to be interested in. We're going to discuss some abnormals and some treatment options to go with them. We're going to discuss some of the supplements that we have today on special. And actually, I hope everybody got a chance to taste one of the supplements, which is my favorite one. It's called RelaxMax. If you haven't, go ahead and grab a little taste. And then we're going to review some discussion about low sexual desire disorder. So what is a hormone? Well, a hormone is basically a key that unlocks a lock. It's a substance that's produced in a special tissue. It's released into the bloodstream. It travels a specific distance, and then it can exert its characteristic effects. It's made from cholesterol, or all hormones are made from cholesterol. And there are various states that we measure. Total, which is basically the total amount of circulating hormone. The free hormone, which is the amount that's bioavailable. That's the amount of hormone that we can actually utilize by our body. And then there's bound hormone, which is the inactive or kind of that sheathed hormone that's circulating, but your body can't use it. So here is a graphic of our menstrual cycles. The menstrual cycle basically is a little bit complex, but what I want you to take away from this slide is that there are two phases: the follicular phase, which lasts the first 2 weeks of the cycle, and then the second phase is luteal phase, so that's days 15 to 28. And within those phases, the take home from this graph is that in the follicular phase, those first 2 weeks of your period, you can see this yellow line, it's mainly estrogen dominant. And then during the second 2 weeks rather, you have a progesterone dominance. So let's start talking about some of the hormones. Estrogen is basically the typical, thought of as the female hormone. It's produced in our ovaries, but the body has receptor sites all over the place. You have estrogen receptors in the brain, in the muscle, in the bone, in our guts, in our bladders, uterus, vagina, breast, eyes, heart, lungs, and blood vessels. That's just to name a few. And it's responsible for over 400 functions. It regulates our taste, our touch, hearing, and smell. It regulates your skin tone. It gives you that elasticity in your skin. It decreases cholesterol, blood sugar, blood pressure, maintains bone structure, memory, prevents macular degeneration, and cataracts. This hormone also relates to a sense of female pride and sensuality and vitality. And there are multiple forms of estrogen, but the three most important are the ones that we're going to discuss today. There's estrone, or E1. This is our storage form of estrogen. And we most predominantly form it postmenopausally. So after you go through menopause, this is the type of estrogen that your body is most readily producing. And it's also the most procarcinogenic, meaning it's the most likely to lead to cancerous type behaviors. It also prevents the loss of bone tissue. Estradiol, that's what we kind of commonly call E2. This is our strongest and purest form of estrogen. And it's mainly it's the main form of estrogen that we produce before menopause. It's 10 times more powerful than estrone, that's the first one, E1. And it's 80 times more powerful than E3, which we still have to discuss. And it promotes new bone tissue and lowers cholesterol as well. E3 is the third type of estrogen that we'll discuss, and that one is cancer protective. It's our most gentle, and it's an adaptogenic. So what that means is that this particular type of estrogen, it adapts to the body that it's in. So it's produced most abundantly when you're pregnant, and it also has really interesting anti-inflammatory and gut protecting effects. So one of the reasons why pregnancy, when you're a pregnant person, if you are a person who has autoimmune disease, Crohn's disease, or ulcerative colitis, if you become pregnant, you'll say, oh my gosh, I haven't had any flares. I feel great. I haven't felt this great in forever. And that's because the estriol is being selectively made during that period of time, and you're not having any flares at that time. So it basically helps with mental clarity, prevents hot flashes, night sweats, and it has an anti-cancer role. And it helps with a youthful skin and also helps to keep the vagina lubricated. There's studies that show that if you start using E3 when you first begin menopause, you get more of that heart, bone, and brain protection because because E3 selectively chooses the receptors that E1 would want to bind to, and so you get some of that cancer protection. It's also typically safe in patients who have a history of reproductive or hormone-sensitive cancers. And when we write for estrogen, we usually do it in a cream, and we usually do it in an 80 to 20% ratio. So we'll do 80% estrogen 3 and 20% estrogen 2 in order to give you that protective benefit. So here are some signs, common signs of estrogen deficiency. I'm sure we're familiar with a lot of these. So hot flashes, night sweats, mood changes, mental fog, forgetfulness, depression, minor anxieties, difficulties falling asleep. So these are all, what we typically think about when we think about estrogen deficiency. But some that I thought were interesting and thought worth kind of discussing are you also get a decreased sense of sexuality, a decreased sense of sensuality. You get a decrease in your interest in your self-image or your attention to appearance. And so this is kind of one of the reasons we think, it's important to maintain that hormone. So some signs of estrogen excess can include breast tenderness or an increase in breast size. Also water retention, impatience, snappiness, those pelvic cramps, and that can be accompanied with or without bleeding, and nausea as well. So, on this picture, I wanted to kind of explain a little bit about estrogen fluctuations as we go through the cycle. And it's important for us women to understand this because once you understand how your body is behaving within the cycle, then you can kind of learn whether or not you're a person who's estrogen dominant or estrogen deficient. And so the way to kind of know is that you can see the week after your period, right around days 10 to 14, that's when you have the highest level of estrogen in your body. And so if you are feeling great on days 14, you feel like $1,000,000, you feel confident, you feel like you're verbalizing all your words well, then you're probably somebody who's estrogen deficient because all the other times of the month, you have less than that. Conversely, if you're the type of person, you get to that second week, you're on day 14, you feel horrible, your legs are swollen, your breasts are swollen, they're bigger in size, then that probably means that that's too much estrogen for your body, and your body's not happy there. So you're probably walking around with the right amount of estrogen later on in that cycle. So you have too much. So it's just good for you to be able to identify that since it's your body. Moving on to progesterone, this is our anti-anxiety hormone. This is that hormone that helps us feel cozy and comfortable and helps us to sleep. Progesterone maintains the pregnancy. It helps to balance estrogen. It modulates anxiety and promotes bone building and fat burning, helps to regulate blood sugar, and it protects breasts and uterus and potentially ovaries from cancer. It's a natural diuretic. So again, if you think about that last chart, if you have too much estrogen and progesterone balances estrogen, and you've got way too much estrogen and your ankles are swollen, and you put that progesterone in balance, now you're diuresing all that water. Also helps to decrease or diminish PMS and menstrual flow, and that's just to name a few. There's a couple more listed there. It helps with lowering good cholesterol, increasing good cholesterol, and reducing that breast pain as well. So we've all been here. We've all been here. And so you think of progesterone as your PMS hormone, right? When you don't have enough progesterone, you have symptoms of PMS. And to go along with that, other symptoms can include not getting a period at all, which is known as amenorrhea, getting an infrequent period, getting heavy or frequent periods, or spotting before your period, and then those painful cystic breasts, and any type of uterine growth is usually related to low progesterone. So endometriosis, adenomyosis, fibroids, as well as, like we said, progesterone is our, it's like our anti-anxiety hormone. So if you don't have enough, of course, you're going to be irritable and anxious, and also retain water. So if you have too much estrogen, again, it's that anti-anxiety, sleepy hormone, so you're going to feel drowsy, you're going to feel dizzy, you're going to feel drunk. And sometimes people will say, my arms and legs, they just feel heavy. I don't know how to explain that, but that's what they'll say. And so here's testosterone. I like this because testosterone is not just a male hormone. I think that's a really important point to make. Testosterone is the most abundant and biologically active hormone that women have in their bodies. And if you look at this graph, in pink you see testosterone throughout the lifespan is constantly, not just a little bit more than estrogen, which is in blue, but significantly higher, right? So testosterone is typically thought of as a male hormone. It's totally overlooked in the female body, and it's super important. So you get a rise of testosterone, you get the peak of testosterone around the age of 25, and then it slowly starts to decline. A myth about testosterone is that it masculinizes females, and that's not true. It actually stimulates femininity. There's overwhelming biological and clinical evidence that testosterone can actually be cardioprotective, so it protects your heart. It decreases bone deterioration, can decrease excess body fat, and help you to maintain your muscle mass. It also elevates norepinephrine levels. Norepinephrine is a neurotransmitter that's related to depression. So if you have a nice amount of testosterone, you're protected from anxiety and depression. And also, going along with that, increases your emotional well-being, your confidence, and your motivation. That helps to maintain your memory. So this is our famous symptom of testosterone deficiency, bingo arms. So if you don't have enough testosterone, you're going to get bingo arms. I don't know, that doesn't motivate you, I don't really know. So you're going to lose muscle tone, you're going to have some anxiety and fatigue and depression, dry thinning hair, lack of energy or stamina, you're going to lose some coordination and balance, a decrease in sex drive, a loss of sense of security, that indecisiveness. And one of the telltale signs that your testosterone is low, if you look at a woman and she has that kind of sunken in, saggy cheek look and those thin pencil lips, that's a sign of testosterone deficiency. So you get on board and you get excited about it, and then you take too much. So too much is not good. Usually we'll see this much in somebody who's taking exogenous testosterone. So you're going to get that oily skin, the acne, that bossiness, that hair growth, the body hair growth. You're also going to experience infertility and irregular periods. And you're going to have some cravings. So the hair growth, we typically see that when we write for testosterone, we usually write it in a cream, and we recommend that you put it on your inner legs. Usually, if you're using too much of it, you'll see hair growth in that area where you're putting that cream. So next is DHEA. This is a hormone that's made in our adrenal glands, but we have a small amount that's made in our skin and our brain. It's a really awesome hormone. It's a precursor hormone, meaning that this hormone makes all of your sex hormones. So if you don't have enough DHEA, you're never going to have enough estrogen or testosterone. So this is the most abundant, not biologically active hormone in the blood. Similar to testosterone, it peaks around age 25 and it gradually decreases over time. If you utilize this as a supplement, it can help to prevent obesity, cancer, diabetes, heart disease, stimulates the immune system, and extends longevity. High levels of DHEA have also been shown to have a cardiovascular risk and to promote healthy aging. And interestingly, patients who suffer from infertility, if you supplement them with a little bit of DHEA, there have been studies showing that pregnancy can occur. So that's a kind of a nice, quick, easy way to fix. This is a very, very simplified, rough schematic of the pathway that cholesterol takes to develop a sex hormone. All of our hormones come from cholesterol. So, and cholesterol is made in the liver. So it's super important to understand that when we talk a little bit later on about detoxification and the role that detoxification plays in maintaining healthy estrogen and testosterone levels, and all really hormone levels. So you start with cholesterol, it turns into pregnenolone, turns into DHEA, and DHEA is what makes the testosterone and estrogen. Then I wanted to include this because this is a little bit closer to the complexity of how the pathway goes, but it's like still simplified. So again, just to kind of reiterate how complex the pathways are, in order to start from cholesterol and end up with progesterone, end up with DHEA and testosterone and estrogen. So it's really important that you maintain that detoxification and make sure that your body is going in the right direction so that you can get all the way down to estrogen and progesterone. It's a little bit higher up. Okay, so here are some signs of DHEA deficiency. So if you don't have enough DHEA in your body, which we frequently see in patients like, for example, lupus patients, you'll see like difficulty dealing with stress, a lack of stamina, intolerance to loud noises, chronic fatigue, bad moods, bad immunity, memory loss, poor muscle tone, dry skin or eyes, and a poor sex drive. But if you have too much DHEA, which we can see in patients with polycystic ovarian syndrome, then you see a lot of body hair growth. You see loss of hair on top of the head, oily skin and acne. You get that edginess, that irritability, that fatigue. Your voice gets deeper. There's sleep disturbances, and we frequently see weight gain. So here's melatonin. Melatonin is our super hormone. This is a hormone that helps you to grow younger at any age. It's secreted by the pineal gland. This is a gland that lies deep in the recesses of your brain, and that gland is the thing that controls your body's biological clock. So darkness stimulates the pineal gland to secrete melatonin. So if you're someone who watches a lot of television before you go to sleep, or if you sleep with the television on, or if you are in front of your computer screen or your phone, those screens, they emit blue light, and that blue light activates your brain to think that it's daytime. So it's going to prevent melatonin from releasing, and you're likely going to be walking around with lower melatonin levels. So of course it promotes sleep. It decreases cortisol levels. So if you are someone who has adrenal fatigue, and you know that your adrenals are shot and you're taking an adrenal support supplement, you really shouldn't take melatonin because you're going to be working against yourself. So that adrenal gland is going to be squeezing and squeezing to try and make some cortisol, and then you're going to kind of deplete it when you take the melatonin. So melatonin, interestingly, enhances the effectiveness and reduces the toxicity of chemotherapy. So a lot of our cancer patients, we recommend that they utilize melatonin. It also decreases anxiety, provides bone protection, enhances natural killer cell protection, which is one of our major immunities, and it also enhances the production of thyroid hormone, promotes zinc utilization, and my personal favorite, maintains hair color. So if you have too much melatonin, you're sleepy, right? Because you've got that sleep hormone going. So you're going to be drowsy when you wake up. You're going to feel depression. You might have headaches, and some people report they get wild dreams if they're having too much. Don't get carried away. It just means that they're vivid. So also, some patients will report they wake up feeling very nervous, like they jump out of bed, their heart's pounding, they're sweating, and that's really an indication that you've got too much thyroid. And so you just want to back up off the melatonin and see if that will help. So all these hormones and all these pathways that we have to go through, what can go wrong? Well, you can get abnormal periods, you go through menopause, perimenopause, you go through menopause, you can develop PMS, you can develop polycystic ovarian syndrome. If your hormones aren't balanced, you can develop recurrent vaginal infections, interstitial cystitis, which is basically a bladder condition, urinary tract infections, and then osteopenia, osteoporosis. So let's say you are a person that gets abnormal periods. This is your body's first indication that your body is not in balance. Your body's telling you your hormones are out of whack. So if you're somebody who's having abnormal periods, this is a great time to address that. So amenorrhea basically means you don't get a period. And there's two types. There's primary, which can usually be the result of a lack of organs, a pituitary gland problem, that's the gland that's located in your brain. If you don't have enough body mass, if you're through anorexia or excessive exercise, if you have too much stress, abnormal chromosomes, or malnutrition. Secondary amenorrhea, meaning you used to get a period and now you don't anymore for whatever reason. That's usually the result of, well, commonly we see it in pregnancy and breastfeeding, polycystic ovarian syndrome, birth control pills, and certain medications. Dysmenorrhea basically means you have painful periods. That's usually the result of growths in the uterus, so fibromyalgia, or endometriosis, adenomyosis, fibroids, pelvic inflammatory disease, which is usually the result of sexually transmitted infection, or cervical stenosis. So menorrhagia means you have abnormal and heavy periods. And that's usually due to cancers, again with growths, fibroids or endometrial polyps, infections, fluctuations in weight, bleeding disorders. Oligomenorrhea basically means you have infrequent periods. And this can be a side effect of the birth control pill. It can also be an eating disorder, or if you're very heavily exercising and you're doing a lot of sports. If you have any type of diabetes or thyroid problems or any type of hormonal fluctuation, you can suffer from these infrequent periods. But medications can also cause it, and kind of the classic ones are anti-epileptic medications or antipsychotic medications. So menometrorrhagia means you have irregular, heavy periods. And this is usually due to any type of hormonal imbalances, any type of uterine growth. We've already kind of gone over that, and adenomyosis or endometriosis. If you don't ovulate and if you have a blood clotting disorder, you're at risk for this. So in our clinic, we try to address things in a stepwise fashion. So when someone comes in and they're having an abnormal period, the very first thing we do is talk about your diet. And we say, what can we do to modify your diet? What can we do to modify your lifestyle? And how can we detoxify you? Remember, all hormones are made from cholesterol, and cholesterol is synthesized in the liver. So if you're not detoxifying properly, you're not going to be able to go through that whole pathway that we looked at, right? You're not going to be able to effectively get from cholesterol all the way down through that pathway. So something that we can recommend for patients in order to develop normal cycles is seed cycling. And this is a really interesting way to try and evoke that period to normalize. So if you're someone who doesn't get a period at all, you would use the new moon as the first day of this, as the first day of your cycle. So you look on the calendar, you say, okay, June 14th is the new moon. That's when I'm going to start my seed cycling. And on days 0 to 14, you would use anything that is estrogen dominant in terms of your to add to your diet. So we recommend flaxseed or sunflower seed, 2 to 3 tablespoons a day. You put it in your granola, you put it in your smoothie, you put it on your salad. And that's if you don't get a period, you start with the new moon. But if you do, then it would be on the first day of your cycle. And then, so remember we said the first 2 weeks of your cycle are estrogen dominant, the second 2 weeks are progesterone dominant, right? So from days 15 to 28, you're going to want to use something that's a progesterone supportive food. So pumpkin seeds and sesame seeds, if you do 2 to 3 tablespoons at a time, that should help you to normalize, if you can stick to it. And so after that, we would recommend nutritional supplements. So gabalinolytic acid is a great supplement that helps to support progesterone. We see that in borage oil, evening primrose oil, blackcurrant seed oil, to name a few. We also recommend chaste tree or vitex, which supports progesterone, saw palmetto, which helps break down dihydrotestosterone, which is our most powerful form of testosterone, to help reduce, for example, if you're a person who has polycystic ovarian syndrome, that would help break down some of that testosterone. Black cohosh, another phytoestrogen that supports estrogen. So then the next thing we need to do is repair your gut. Again, that detox pathway is super important. If you're not processing, if you don't have a one-way loop and you're not pooping properly and you're not digesting properly, you're going to reabsorb all those toxins, it's going to mess you up. So we do that with the classic R's, the 4 R's. We remove, we repair, we repopulate, and then we reintroduce. And there's a couple of supplements I listed there that can do those things. So AC2 formula, that's one of my favorite anti-yeast, antifungal treatments. It's basically caprylic acid, bromelain, undecyllic acid, grapefruit seed extract, and berberine sulfate. Vitalzymes, that's a digestive enzyme. If you're somebody who's not digesting your food properly, you need to repair that with enzymes to help you. Repopulation, these are my two favorite probiotics and gut repairs. Probiomax IG26, maybe like my top 5 supplement. It's a combination probiotic and gut repair tool. OptiCleanse DHEA, if you're like someone who loves their smoothies in the morning, that's a great, it's a powder, you mix it in with your smoothie, gives you a little bit of pea protein. And then the reintroduction is that probiotic 225. It's a powder, it's a very high count, and it's a really nice probiotic. So after we do all that, then we could recommend some IV therapies for you. Ozone therapy is a great thing that you can do to help improve your immunity. It also helps you to utilize oxygen and do some mitochondrial repair. Myers cocktails that we have here are IV treatments that utilize multivitamins in order to give you that boost of energy and also to help give you some of that detox. Chelation is something that we do, it's an IV that we utilize to remove any type of heavy metal or toxin from the body. And then glutathione and ALA, alpha lipoic acid, two really great IVs that we utilize. They're antioxidants, they're really, really great for liver detox, and if you have any type of insulin resistance or any type of like neuropathies, those are, ALA is great for that. Okay, so perimenopause, that means around menopause. Like you're not really there yet, but you're starting to have a little something going on. It usually happens around 3 to 4 years before you enter menopause, but it can start 10 years before menopause. So we commonly see this in patients who are in their 40s, but again, you can start in your late 30s. And so what's happening is your ovaries are starting to produce less estrogen, but you're still ovulating, so you can become pregnant. Now, perimenopausal symptoms are very frequently confused with PMS symptoms, and a lot of patients come in and they say, God, ever since I've turned 40, I feel like my PMS is worse. And what's happening here is you have to realize that PMS symptoms, they are related to a progesterone deficiency. But perimenopausal symptoms are caused by estrogen deficiency. So what's happening here is you're developing some premenopausal symptoms, and it's because you're losing your estrogen. So again, we've kind of looked through these already. That dry, thinning hair, the hair loss, the heat flashes, that sudden burst, that wave of heat, the insomnia and the night sweats and the grumpiness, but also urinary urgency, gotta go better, get there kind of a picture, the vaginal dryness and weight gain, and also the telltale difficulty concentrating. Usually at this age, we start blowing it off, like, you know, I've had a couple kids, I can't concentrate, but it could be the beginnings of perimenopausal symptoms. So you get through all of that, and then you're in menopause. Yay! And so menopause is defined by a lack of a period for 12 consecutive months. Your ovaries are no longer producing an egg. The estrogen production has slowed down significantly, arguably halted. And usually this happens around age 50 or so. And the average duration of menopausal symptoms is 10.2 years. So here are the symptoms. And we've gone through these. We don't need to go through them again. We know the menopausal symptoms. We all make fun of each other for them. What I wanted to highlight on this page is that there are a lot of menopausal symptoms that you don't think about. So irregular heartbeat. Irregular heartbeat can be a symptom of menopause. And you can go to your cardiologist and you can get the echo and the EKG and the stress test, and they say nothing's wrong with you. You just have an irregular heartbeat. Or you can say, doctor, I'm feeling dizzy. I'm getting like a numbness and tingling in my arms. I feel like itchy, creepy, crawly. My tongue is burning. Everyone looks at you like you're crazy. They blow you off. It could just be a menopause. It could be menopause. It can be that lack of hormone balance. So it's important for us as women to advocate for ourselves and to know our bodies so that we can say to the doctor, I'm having menopausal symptoms, you need to check my hormones, and I need to do something about it. So what is bioidentical hormone replacement therapy? Bioidentical hormones are molecularly identical hormones that are recognized by the body. Traditional hormone replacement therapy, when you go to the doctor and you get traditional hormone therapy, that is a molecule that your body does not recognize. Your body, the receptors of those hormones, they don't recognize the molecule. And what ends up happening is when that molecule gets metabolized by your body, it metabolizes into carcinogenic, meaning cancer-causing metabolites. And there haven't been any studies done to know where those metabolites go. We actually have no idea where they go in the body. So why would you put something in your body you don't know what it is, right? So what is the goal of bioidentical hormone replacement therapy? So the truth is, not everybody needs bioidentical hormone replacement therapy. If you are someone who's nutritionally sound, you're not stressed, you exercise, you are not overweight, and you're not toxic, your body will make the right amount of hormones both before and after menopause. But the reality is, in the world that we live in today, very few women fall into that category. So what we're trying to do, what the goal is to restore that hormone level back to balance. And we want to provide protection and to have those benefits obtained from, we want the benefits from the balance. So an improved quality of life, right? This is a study showing that bioidentical hormone replacement therapy has been effective in reducing vasomotor symptoms, mood, and quality of life. A reduction of osteopenia, osteoporosis, right? The breakdown of bone. The greatest benefits, if you institute bioidentical hormone replacement therapy just shortly after menopause, you get a greater benefit of bone loss, and the incidence of fractures are reduced. Cardiovascular benefits. A study from 2013. Despite high stress life, this study found that cardiovascular markers, inflammatory factors, immune signaling factors, and health outcomes were overall favorably impacted by bioidentical hormone replacement therapy. So prior to starting, you got to get your hormones checked. It's useful to have a recent physical and gynecological checkup, a breast exam, a mammogram, and a pap smear in order to know what your baseline is. And it's nice to have a pelvic ultrasound to learn what the status of the endometrial lining is. So we don't want that to be too thick or too thin. Super important to address your stress management and your sugar levels. And then let's go over a few things about the way that we administer the hormones. So vaginal creams, there's capsules, there's patches you kind of stick on, there's pellets that you can inject into your skin, there's troches, which are sublingual tablets. You kind of put them under your tongue, and the idea is they dissolve and go right into your bloodstream. Then you can also use substitutes for natural estrogen. So black cohosh, dungquai, pomegranate, red clover extract, soya and yam, maca, and raptonic rhubarb are all good substitutes for natural estrogen. Cancel. I need to do an update. So what I want to say is, generally speaking, we like transdermal hormones because oral doses, even though they lead to a more rapid metabolism and they require larger doses in order for us to get the actual required amount that our body needs. What ends up happening is you take that dose, you have to digest that hormone, and it passes through the liver, gets all chewed up in the liver, you make all the metabolites from the hormone, and then you have just a small amount left. Also, transdermal delivery of estrogen in particular results in a more effective and readily available hormone. Your body has no idea where it came from. It just sees it and it's like, I need that, and it uses it. Progesterone, on the other hand, it's more commonly prescribed orally, and that's because progesterone, when you put it in a cream, it tends to be more variably absorbed, so it's a little bit harder to control in that way. Okay, so I really like this slide because this is a graphic giving you the difference between a natural and a synthetic estrogen. So you don't need to be a chemist to see just visually that these hormones these structures are completely different. You can see over here there's a methane group, there's a hydroxyl that's not over there. And basically, why I wanted to include this was because I wanted to tell you about this study that was done in 1991 called the Women's Health Initiative. It's a very well-known study. It was done by the National Institute of Health. And in this study, they did randomized controlled trials that were designed to address women's cardiovascular disease, cancer, and osteoporosis. And what they did was they put a couple of women, a lot of women, in a placebo group, and then they put a lot of women in an estrogen progesterone group, and that was called PremPro. It was a synthetic estrogen progesterone group. They actually halted the study 3 years earlier because the study revealed that heart attack risk was increasing in the patients that took the progesterone. And remember what we said, that estrogen, it breaks down into multiple metabolites, and synthetic estrogen breaks down into very carcinogenic or cancer-causing metabolites. So here's another, this is the chemical structure of natural versus synthetic progesterone. And again, you can see the molecular structure is extremely different. So the NIH did a follow-up study called the HERS-2 study. And this one was basically showing, it stood for Heart and Estrogen Progesterone Replacement Study. This one showed an increase in cardiovascular risk for women taking synthetic progesterone, and also unfavorable effects on cholesterol and increased risk in patients to develop ovarian cancer. So when you're thinking about traditional versus bioidentical hormone replacement therapy, I feel like this study is really useful, because this one is saying bioidentical hormones are associated with a lower risk of breast cancer, cardiovascular disease, and they're more efficacious than the synthetic counterparts. So you sit with your provider, you're going to develop a plan once you get all this information, right? You and your provider are going to address your sugar and your stress level. You're going to develop a personalized diet, and you're going to do some detox, and we're going to start with supplements. So we should start with my favorite one. This is my favorite supplement. It's called RelaxMax. We have it over here. If you haven't had it, have some. And it's awesome because it tastes delicious, and it combines a blend of ingredients that are going to help you support your body's natural synthesis of brain chemicals, neurotransmitter GABA, hormonal balance, and it's going to promote also a healthy glucose metabolism. It's very, very well researched, this particular supplement. So here's a double-blind study showing that inositol, one of the constituents of the supplement, had a significant antidepressant effect. Okay, so here's another one saying inositol can reduce panic attacks. And then here's one saying that inositol can improve the metabolic profiles of patients with polycystic ovarian syndrome. Also contains magnesium. Magnesium relieves symptoms related to mood changes. Also helps normalize your bowels. It helps with muscle tension. Taurine is great for health and longevity. Also gives you some antihypertensive effects, meaning it can help with your blood pressure. GABA, this is an inhibitory neurotransmitter. The study is showing that within 1 hour of taking this particular form of GABA, it can induce relaxation and diminish anxiety. And L-theanine. L-theanine has a significant effect on the general state of mental health, mental alertness, and arousal. So a really cool supplement. Next is DHEA, another really great fundamental supplement. DHEA supplementation has been shown to be protective against cancer, diabetes, obesity, and heart disease, and autoimmune diseases as well. It can stimulate the immune system and extend longevity. Now, DHEA naturally peaks in our bodies between 6 a.m. and 1 p.m. So you want to take this supplement around breakfast time, and it's fat soluble, so you want to take it with a meal. And then generally you can start with 5 milligrams, and you can increase that dosage every 2 weeks until you feel an improvement in mood, that mental clarity, that increase in energy, stamina, confidence. What ends up happening is if you feel like you've taken too much, you'll start to develop some side effects like oily skin, edginess, pimples. If you feel like that happens, just discontinue it. You're going to wait until your symptoms resolve, and then you can start it at a lower dose. But Recommended for people who are stressed, who have low energy, who have low immunity, high insulin levels, low blood sugar levels, cardiovascular issues, any type of endocrine disorder, infertility, any type of mental illness, or dry skin. I mean, sounds like everyone to me. Okay, so here's some studies about DHEA. This is just a study saying that there are beneficial side effects of DHEA in patients postmenopausal without any side effects. Okay, in patients with lupus, DHEA can be an immune modulator, which means it can stimulate or suppress the immune system depending on what the body needs. So it's a really great supplement. And then this is our last supplement. It's called Aromatate PM. This is a great supplement for patients who are needing symptomatic relief of menopausal symptoms. We also use it for men with excess estrogen levels, but we're not talking about men today. So this is a product that contains a hop extract called 8PN, and the substance has been identified as a potent phytoestrogen, which basically it means a plant-based estrogen. So it gives you that plant-based estrogen activity, but it also affects aromatase, which is one of the enzymes in that humongous pathway that we showed. And the aromatase enzyme is responsible for converting circulating androgens like testosterone into estrogen. Okay, so this formula basically supports cardiovascular health, bone, breast, and prostate health, and it promotes relief of menopausal symptoms. So here's some studies about it. This is a study showing that there are favorable effects on vasomotor symptoms, meaning those hot flashes. All right, and then this is another one saying the same thing. Okay, this one is suggesting that treatment with 8PM results in increase in bone mineral density. And so today we have all three of these supplements available. I believe we're giving 10% off each one, and if you get all three, you can get 15% off today, and then a digital copy of Dr. Magaziner's Wellness Guide. Come on, I was expecting more. It's hilarious. Because it's true. All right. So, low sexual desire disorder is something that affects 43% of women and 31% of men ages 18. And so this level has been reported as sexual dysfunction at some point in their life. And it's super, super under-discussed. It's like nobody wants to talk about this, and it's really important because it's happening. And so the diagnostic criteria is the absence or reduction in interest of sexual activity or sexual thoughts, reduced or no initiation of sexual activity, absent or reduced interest in sexual interest or arousal in response to either an internal or an external cue. And the thing is that low sexual desire disorder, it's not an aging thing, okay? It's a health problem. And it's the health problems that cause most of these sexual issues. Most healthy individuals are having sex into their 90s. So it's a health issue, and it should be viewed in that way. So sexual problems are associated with relationship problems. They interfere with overall health. They're a marker for undiagnosed and comorbid conditions. And the number one reason that people do not have sex is related to stress. Stress wreaks havoc on our bodies. So regarding low libido, there's two types. There's acquired and innate. Acquired is the most common predictor is relationship satisfaction. So you say, do you like your partner? When was the last time you had sexual desire for another person? How about yourself? When was the last time you felt sexual desire for yourself? Are you unhappy in other areas of your life? How do you rate your finances, your career, your family, your friends, your personal growth? Innate low libido, the most common predictor is a history of abuse, anxiety, obsessive compulsive behavior. So some of the questions we say are, have you ever had sexual desire for yourself or someone else? Does your culture or your family value system or your spirituality interfere with your desire? Has there been an event in the past that influences your lack of desire? So there are 4 root causes of low libido. We're going to go through them. So the physical causes are hormonal imbalances, and that doesn't necessarily mean just sex hormones. It can be thyroid lack of balance. It can be an adrenal gland. The pancreas could be out of balance. So is your hemoglobin A1C off? Is your insulin level high? Is your fasting blood sugar high? How about neurotransmitters, right? If we're having some symptoms of serotonin or dopamine or norepinephrine, epinephrine disbalance, maybe some symptoms of depression, that can be a physical cause of low libido. Autoimmunity, cancer, belly issues, gut disturbances, lots of medications, surgeries or radiation can all cause low libido. Okay, so mental causes, the root cause of mental causes is generally a negative belief about the partner. So are you in conflict with your partner? Do you not feel safe? Is there a desire discrepancy? Does one person initiate sex and the other is not interested? And is that always the balance where one person's never initiating sex and the other is always initiating sex? Feeling unattractive, having automatic negative thoughts or being distracted by non-sexual thoughts? Having scheduling conflicts, we're too busy to have sex. Feeling that the partner's not skilled enough, feeling that the partner wants to do something that you don't want to do sexually, or feeling like your partner's using sex to gain power. Okay, emotional causes are usually related to your intimacy needs and the fact that your intimacy needs are not being met. Research shows that if you are a person who feels like your intimacy needs are not being met, you're likely withholding sex from that person. Having an inability to forgive transgressions of an old partner or a current partner. Sometimes something that happened in a different relationship has nothing to do with this person that you're with, shows up in the bedroom somehow. Or experiencing a trigger of past trauma. So are you a victim of sexual assault, physical or emotional or verbal abuse? And finally, spiritual causes. This is one that's again overlooked. Family norms, spirituality, your value system. Are these things interfering with your sexual desire? A lot of women particularly are raised in a culture where we are taught sex is dirty. Big girls don't do this. You're supposed to wait till you're married. And your needs are not important. Only the needs of the man are important. Now there are some issues that tie into multiple categories, right? And childhood trauma fits into this category. Now a childhood trauma can be sexual or non-sexual, right? Not being picked for the team, tripping in front of that person that you like when you're 10, or being bullied growing up. If you're a young person and you've experienced a trauma like this, your brain has experienced something that it cannot explain. And so what you do is you make up a story about it, like, I'm not desirable. And that story becomes integrated into your belief system and into your adulthood, into your sexual makeup. And for women, it's typically shrouded in negativity, shame, and guilt, which further complicates your sex life. So your sexuality develops as a culmination of that lifelong narrative of experiences, cultures, family norms, and the meaning that you attach to all of those things. So this is a really great slide because it's compelling in the sense that studies have shown that areas of the brain that are affected by trauma are the same areas of the brain that are engaged in sexual desire. And it's not just traumas. Studies show that chronic stress lights up the prefrontal cortex on MRI in the same way that old traumas do. So I want you to all imagine you're in your bed, you're sleeping, you're finally sleeping. The fire alarm goes off. You open your eyes and the house is on fire. You wake up, you look around you, and your heart starts beating. Your sympathetic nervous system is fight or flight, it's on. Your heart's beating, your body is pumping blood to every part of your body so that you can move. Your eyes dilate, your pupils become big so that you can see everything because you got to get out, right? Your brain is hyper-focused. You got to survive. You know in that moment, you don't have time to stop and use the bathroom. You don't have time to sleep. and you know that you don't have time to have sex. Your sympathetic nervous system has been activated, and you only have time for the most essential things you need for survival. So there goes your memory, there goes your GI health, and there goes your sex life. That level of stress is being experienced less dramatically on a daily basis. We are living with low levels of stress that are chronic, and therefore we're living in a hyper-vigilant state. And our nervous system, our sympathetic nervous system, that fight or flight is constantly turned on. And that hyper-vigilant response that you experience in connection to that old trauma is showing up in your low libido. It's showing up, that daily stress, that chronic daily stress, showing up in your low libido. So what do? We gotta rewire that sympathetic nervous system. We have to tune down that hypervigilant response, okay? And we need to let the body know that the messages that we're receiving are outdated and they're not healthy. We need to update our operating system. So how do we do that? Basically the same way we heal the gut. We need to heal the past, reset default setting. That factory default setting, we gotta reset it. And so we do it the same way we clean up the gut. We remove, by confronting those old hurts, we remove that old belief system, we remove that negative emotion, we remove toxicities, both physical and emotional, we remove that gut dysbiosis and that poor diet, and we replace it with self-awareness, with a positive belief system, by creating healthy boundaries, by replacing our hormones, our digestive enzymes, our amino acids, our neurotransmitters, and adaptogens and botanicals and nutraceuticals. And then we repair those maladaptive pathways with healthier adaptive processing loops. You see a therapist, you balance your blood sugar, you repair the damage done by inflammation, the damage done to the digestive tract and the urinary symptom. Repair the detox pathways and the adrenal pathways. Repair that pelvic floor muscle on the vaginal wall. Then you have to re-inoculate with a new cognitive belief system. We need to re-inoculate your gut with healthy microbes and your body with healthy mitochondria. And then we have to rebalance, because our stress isn't going anywhere. So we have to develop stress-reducing strategies. We have to learn how to sleep. We have to develop an exercise program and hydration, and a personalized nutrition program, and develop a spiritual connection. Your libido is your life force. People with healthy libido report better quality of life, better physical and emotional satisfaction, and better overall happiness, as well as improved interpersonal relationships. Our libido is our life force, so we have to honor it. Questions?
That DHEA and the RelaxMax, can you take that with other supplements as well?
Yes.
When you do like the hormone creams and stuff like that, is that constantly like a thing that needs to be changed, like over the years, or like how does that work?
It's an individualized program, and it's something that we would monitor every several months.
Oh, okay.
Once we obtain a level where you're kind of smooth sailing, we really don't need to check the hormone levels except for like every 6 months to a year.
Okay.
And then the creams, you want to apply the creams 6 days a week. You don't want to apply them every single day, because what ends up happening is your cells will develop like a memory to that hormone, and it'll stop absorbing it. So you need to do what's called like a hormone holiday. So I usually say pick a day out of the week, like Saturday or Sunday, because you're never paying attention to what you're doing on the weekends anyway, and just skip it. So just do it Monday through Saturday, and skip Sunday, for an example.
So I don't have a uterus, but I have my ovaries, right? And my general, so I don't know where I am, but when I have had my general checkup, apparently my blood tests show that I'm not anywhere near even perimenopause, but I'm almost 50. So like that's, to me, seems not right. So like my question is it typically shown in blood tests? How do you determine?
So blood test is one way that you can test. Generally speaking, when you go to a traditional doctor, they're only going to test a few markers. So you may need a more comprehensive blood test in order to be able to determine where you are exactly. But if the blood tests don't show, we can always do other options, like we can do a salivary test or urinary test as well. Yeah. Is there another one?
I have
Yep.
I was curious what tests you guys use particularly here.
We have all of those. We generally do blood because it's just the most convenient and is generally covered by insurance. But you can definitely do salivary, which is the most accurate way. But it's an out-of-pocket cost, and it gets costly, particularly when you're trying to balance the hormones and you're checking every 3 months. So usually, if you're tough to nail down, we can start with a salivary test, and then to do the initial to kind of do the testing every 3 months or so, we can do blood, and then once we kind of know where you're living, we can just keep you there.
So if I was going to come and make an appointment, is there a time of the month that's better, because then you can get the blood work done as soon as you're there? Like, how does that work?
The best time to test your hormones is between days 18 to 21. It's a small window, or 14 to 21. 18. 18. That's the best time, and we can do it at any time. It's
Well,
fine.
how are you counting
Optimal.
days? Because I'm not understanding what you're saying with that 18 to 21.
So day 0 is the first day of your period,
Oh, okay.
and so you would just count from there.
Okay.
Yep.
You can talk about the transdermal creams. Is always the inside of the thigh the best, or is it matter?
Yes, it's best to do inside of the thighs because that's where the skin is thinnest. So you can put it on the underarms, but especially if you have kids, you don't want to put it anywhere where if you're like hugging someone or something, you can transfer it. So there's a funny story about a patient. It was actually a male patient who was doing bioidentical hormone. The doctor said, okay, just put it on for men they do inside of the thighs and on the shoulder blades, but this guy kept putting it on his chest. And so his wife was obviously laying on him, and she went to the doctor and she's like, can I get some of that testosterone cream? I feel great. Because it was how come only the guys are getting this? Okay, everybody, well, thank you for coming. I appreciate your attention. Help yourselves to some